does anyone find this remotely believable for a start? That the children's sugar consumption would halve in the space of a year of the tax being announced? Not even coming in. Now I can see a few people shaking their heads. Rightly so. Yeah, it's completely unbelievable, and it's not actually what the study said. The reality is that obesity rates amongst kids at reception aged 4 to 5 and kids when they leave primary school aged 10, 11, the rates of obesity have increased. I don't think the government has the knowledge to know, what my optimum amount of consumption of sugar is versus your optimal amount versus their optimal amount. People are different. People have different tastes and preferences. People have different tolerance of risk. But so long as people are aware of the risks, I think we have to assume that adults, at least, are capable of making decisions. So yes, I'm Chris Snowdon. I'm going to talk to you mainly about sugar taxes, but the lessons are applicable to all of what you might call sin taxes. So sin taxes is a sort of semi-pejorative term for taxes that are used not just to raise money, but to deter people from buying things, basically, and therefore from consuming things. Sugar taxes are one of the more kind of topical and relevant examples of this, but obviously tobacco taxation, alcohol taxation, petrol taxation would probably be included there. But they're not Pigovian taxes per se. They're not necessarily trying to optimize the amount of consumption in the society, which is what a Pigovian tax is supposed to do. They are just trying to drive down consumption, in theory probably to zero. This is just to point out that this has been known to come up in exams from time to time. And here is an outline in simple terms of how these taxes are supposed to work, and it's all fairly intuitive stuff. It's not very complicated. You put a tax on a product that makes the product more expensive. Because it's more expensive, people will, all things being equal, consume less of the product. These are products that have got calories in them, or sugar in them, or both, obviously, if they've got sugar in them. So fewer sales should lead perhaps to fewer calories being consumed. If people consume fewer calories, they're less likely to get obese. And if there's less obesity in society, there will be better health. That is the basic chain. And you can see how that would work or could work. But you can also perhaps see that it might not work, because if any of the links in this chain break down, the whole thing falls apart. So I'm going to go through how these kind of taxes have worked in practice. Now, firstly, the very first link in that chain between tax and price is not as nailed on as you might perhaps expect. So it is quite possible that the retailers or the manufacturers might, for some reason, decide to absorb the cost of the tax. And we will come to a couple of examples of this later on when I look at some of the real world evidence. But you don't have to put the tax on the product. In the case of the UK sugar tax, it amounts to 8p per can of Coke. And that is not an enormous sum of money, given that the price of a can of Coke can vary hugely from 60p to about £1.50, depending where you are. And so it can be absorbed. Also, it's not strictly speaking an excise tax. It's a tax on the industry. So the industry gets taxed according to how much product they get out of the warehouse, but they don't have to put the price up accordingly. They could, in principle at least, decide just to take that 8p and put 4p on a can of Coke, but 4p on a can of Coke Zero or a can of Diet Coke. These companies own lots of different products. They could choose to spread out the cost of the tax across all those products, or indeed just pay shareholders less, or put less into capital investment, and so on. What I'm saying is, it's not inevitable. The government can't force people to put up the price of the product just because the tax has gone on it. And so if the tax doesn't increase the price, obviously the rest of it's going to fall apart straight away. There's no reason to think that you're going to get lower sales. You might perhaps get lower profits, but there won't be any change in consumption. So that falls at the first hurdle. One very likely option is that people just pay up. So rather than reducing their consumption of the product, they would just go, well, I guess a can of Coke is 8p more than it used to be. Huh? I'll just have to pay a little bit more money for it. Now, if they do that, then they're going to have a little bit less money. They will have less money to spend on other products, so their consumption of other products on the margin will decline. But that naturally isn't going to lead to any reduction in calories, well, presumably. Certainly won't lead to any reduced consumption of the Coca-Cola, and therefore there's no chance of it having any implications for health. And then there are a whole range of substitution effects, and this is where these taxes often break down. People will go to some lengths to get what they want in life, and if they really like their sugary drinks and don't really like the artificially sweetened drinks, or in the case of tobacco, they really like smoking or drinking or whatever it may be, very often people will decide that they know what their optimal level of consumption is for themselves, and they're damn well going to continue to maintain that. And they can do that, as shown in the previous slide, simply by just paying a bit more money and spending a bit less elsewhere. But they can also do it by, for example, shopping at a cheaper shop. So if you've been buying your fizzy drinks at Waitrose, you start going to Asda or Aldi, and the drinks will probably be cheaper there. And so you can carry on consuming the same quantity of sugary drinks, and you're not paying any more for it. Or you could switch to a cheaper brand of the same kind of product. This is what people do a lot with tobacco. Somebody who's smoking a premium brand like Marlboro will switch down to something like Lambert Butler, then switch down to something like Richmond, then switch down to rolling tobacco, and then ultimately, in the case of tobacco, they switch to the black market. Now, there isn't a big black market in fizzy drinks because the tax on fizzy drinks simply isn't anywhere big enough to create either the demand or the supply for it. But there's several examples of products, including, of course, products that are totally prohibited, where black markets open up in order to satisfy demand. So there are several different ways, and these aren't all of them either, but there are several different ways, and people can just change their behavior in a different way and maintain their consumption, in which case, again, they're not going to consume any less of the product, they're not going to be less obese, they're not going to have better health, and so the chain falls down. Now, whether these things actually happen in practice is something we can answer with empirical evidence, because quite a few countries have experimented with taxes on sugary drinks in particular. Denmark's had a fat tax. Finland and a few other countries have tried taxing sweets, soft drink, sweets, ice cream, various sugary products, and even sometimes just sugar itself. And so the first question is, do you tend to get the price go up when the tax is put on the product? And unsurprisingly, yes, you generally do. The question is whether the tax is passed through 100% or less than that or more than that. And I don't know if you can see these figures here, and there's a lot of them, but these basically show what happens to prices when taxes are applied to products in Denmark and in Finland and in France, where various foods and drinks have been taxed. And by and large, the story is that the tax certainly leads the price to go up. Very often the price actually goes up by more than the rate of the tax. That's the most common thing to happen. So if you take the example of the UK, 8p on a can of Coke, let's say somebody's selling Coke for 69p, you've got to put 8p on that. You're not realistically going to charge 77p for a product. Everything's got to end in 9. It's all price rhetoric. So you round it up to 79p. So rather than an 8p tax, you've got a 10p price rise, and the company takes the retailer takes the extra 2p profit. It's actually quite a good way of making extra profit, is to take advantage of taxes that everybody knows is going to come in. No one's quite sure exactly what the final price is going to be, and so you round it up a bit, and everyone makes lots of money, the government and industry, both. Then the question is, what happens to consumption from that price rise? And again, we're looking at a couple of Scandinavian countries and France, and also Hungary, which has quite an extensive range of taxes on food, all done in the name of public health. And again, there are a huge number of numbers here. By and large, as you would expect, as economic students, the price goes up, consumption will tend to go down, but it goes down in all sorts of different ways. Sometimes it hardly goes down at all, sometimes it goes down quite a bit, sometimes, occasionally, the rate of consumption actually goes up. And that happens in particular when you've got substitute goods. So the Danish fat tax was literally a tax on saturated fat. And the more fat you had in the product, the more you pay, or the higher the tax would be. But you've got things like butter, margarine, cooking oils, and olive oils, which are very highly taxed because they are basically just fats. But these are pretty much essential for cooking. You need at least one of these, really, for cooking or putting on your bread. And so the question is then, well, the price of olive oil has gone up, but so has the price of vegetable oil. What am I going to do? And we see, for example, in the case of olive oil, the price went up, but consumption also went up. The price of cooking oil went up a lot, 17.7%, and consumption fell by 5.5%. Margarine, the price went up a bit less by 12%, consumption went down by more than that. So it's quite unpredictable is really all I'm trying to say. Economists try and put together price elasticity estimates using data like this, but it varies so much, as you can imagine, depending on what the substitutes are, depending on what different shops are doing. You know, have you got the equivalent of Aldi or Lidl in the country? How's the economy doing? You know, these figures here are taken from 2011, 2012, 2010, when the economy wasn't generally doing very well worldwide. So it's really very difficult to predict exactly what effect a price rise is going to have on consumption. Government impact assessments have to do it, and the Treasury has to do it, but a lot of it is bordering on guesswork. Nevertheless, the basic principle, not very surprisingly, is usually when a tax is applied, the price goes up and consumption goes down. That's pretty basic stuff. What other things happen when these kind of taxes are introduced? Again, let's have a look at the Danish fat tax. This is the sale of fatty products, to put it in simple terms, and the tax came in on October the 1st, 2011. Now what you can see is there's a massive spike just before the tax came in, and that is obviously the result of why was a huge increase in sales before the tax came in. Yes?
They'll get it at a cheaper price and then they'll have to pay the tax rate.
Yeah, they knew the price was going to go up, so they bought as much as they could, and they stockpiled it, they hoarded it. They would put it in the cupboards, in the freezer, in the fridge. And then what happened is you see a small dip in consumption when the tax comes in, presumably because people are still eating all this, right? And then when they've eaten all that, consumption goes up to, well, the tax didn't stay in place for very long. It only stayed in place for 15 months. So we don't have great data on certainly on the medium to long-term effects, but it seems to me that the consumption went up pretty much to where it was before the tax came in. And indeed, that is basically what happened. So you saw hoarding effects beforehand, a dip in consumption as people got through the stockpile, and then consumption went, broadly speaking, back to where it had been, which is one of the reasons the tax was actually repealed in the end, because it was seen as being quite ineffective. It wasn't really changing people's shopping habits that much or consumption habits that much. It was just making everybody a little bit poorer, and it was really hard to administer and all kinds of things. Norway had a sugar tax, had for decades. A tax on chocolate, on sweets, and in 2018 that tax went up by 83% to the equivalent of more than £3 per kilo. This is a picture of a massive sweet supermarket on the border, on the Swedish-Norwegian border, because people in Norway were going over the border to buy cheaper sweets. Now this is another unintended consequence of these kind of taxes. People will, if they have the ability to do so, cross borders to go to a low tax jurisdiction. And you might think, well, are people realistically going to do that to get some licorice? Well, apparently so, because this shop was doing a great trade. Norway then responded by reducing the tax massively, and it has since in fact abolished it. And you can see this a lot, all around the world really, but particularly around in the Scandinavia area. Scandinavia is quite a high tax place, as you probably know, not just on income, but also on various vices, alcohol, tobacco, very highly taxed, spirits in particular, very highly taxed, and they have had experiments with various taxes on food like this. And broadly speaking, the further south you go in Scandinavia, the lower the tax rate. So things are pretty expensive in Norway, and as you go down into Denmark, they've gone a bit cheaper. Sweden's more expensive than Denmark, and Germany's cheaper than Denmark. So what you get is Danes going to Germany to buy their tobacco and alcohol, and when the fat tax was in place, their bacon and butter and Danish pastries, and people from Sweden go down to Denmark, and people from Norway go into Sweden. And you've got a common market, of course, so you can buy as much of these things as you like. In America, you see very much the same thing. You've got big differences in taxes on things like cigarettes, and people will go over the border to buy them. So what's the evidence on taxes on sugary drinks specifically, and the effect then on calorie consumption? If we accept that, broadly speaking, by and large, you do see some reduction in sales, what is the impact on people's calories and on their body weight? Well, this has been looked at quite some years ago now. This study's from 2010, and about 30 odd states in America had some form of tax on what they call over there soda, sugary drinks. And so these economists were able to see what impact they had. Were the places that had soda taxes slimmer than those that didn't, basically. These guys looked at children and adolescents, and they found that soft drink taxes do not appear to have countered the rise in obesity prevalence because any reduction in soft drink consumption has been offset by the consumption of other calories. So this is the kind of substitution effect I was talking about before, where, yep, you can tax your fizzy drinks, but people then maybe will switch to milkshake, or they'll switch to fruit juice because these things are not taxed. They might even switch, if they're adults, to beer or wine, and in some instances they may satisfy their desire for sugar by consuming more sugary food. But the overall message from this study, at least, is that those substitution effects wipe out any effects on calorie reduction that you get from the sugar taxes. And that wasn't the only study. This meta-analysis from 2013 came to much the same conclusion, saying that the effectiveness of a taxation policy to curb obesity is doubtful, and available evidence in most studies is not very straightforward due to multiple complexities in consumer behavior and underlying substitution effects. And it's those complexities in consumer behavior and underlying substitution effects that I'd like you to kind of take home from this talk, that people tend basically to get around these kind of taxes where possible. There's been several quite high-profile sugar taxes. The UK is one of them, and I'll come to that shortly. But Berkeley in California, the city of Berkeley, introduced a tax some years ago, and it was said to have reduced the sale of sugary drinks by 9.6% in the first year. Firstly, I should say that this is an example of the tax not being fully passed over to consumers, so a little bit unusual. That this study found that only about half of the tax was actually passed on to consumers through higher prices. The rest was absorbed by retailers. And the reason for that seems to be that Berkeley is not a country, it's one city. And if you want to avoid the tax, all you have to do is drive out the city to do your grocery shopping. And some people were prepared to do that. The retailers knew that, and so they tried to cushion themselves, or cushion their consumers, their customers, from the tax so far as possible by absorbing that. Nevertheless, in Berkeley itself, there was a reduction of 9.6%. So this is from a study that looked at this particular tax. The dotted line here is, from this point onwards, a counterfactual. These are the sales. You can see they change a bit by season. The tax comes in here during the wonderfully titled ambiguous period. And after that, the dotted line is what the researchers think consumption patterns would look like. And the thick line is what they actually did look like. Now, you can always quibble with these counterfactuals because they're essentially, they're theoretical, hypothetical, and a figment of someone's imagination, essentially. Nevertheless, I think it looks reasonable to say that consumption was fairly static, albeit fluctuating before the tax came in, and it looks a bit lower after the tax. And you also see this increase in the low sugar or no sugar brands. Again, the dotted line is counterfactual, and that's what actually happened. So we seem to see a decline in consumption of the sugary drinks and an increase in consumption of the diet drinks, which is kind of what the policy is supposed to do. So that sounds all well and good. However, I mentioned the possibility people might shop out of town, and that did indeed happen. And so if you look, as the researchers did, at how many calories people were actually consuming, how much they were drinking, you can see that when you look at the beverages that were taxed, the sugary drinks, the fizzy sugary drinks, consumption didn't go down in any statistically significant way. There was a daily average of 45 calories from these drinks before the tax, and it just went down to 39 calories. But you look at the untaxed beverages, so that's things like your milkshakes and your fruit juices, calorie consumption actually went up really quite a bit by, 32 calories. So overall, after the tax came in, people were consuming more calories from drinks than they had been before the tax. And people were also doing more out-of-town shopping, which the local retailers were not very happy about. And that has been seen in other places too, in Oakland, also obviously in America. A study found that there was a slight decrease in the volume of SSBs, that's sugar-sweetened beverages, purchased per shopping trip in Oakland, and a small increase in purchases at stores outside the city. Overall, we do not find evidence of any substantial changes in the overall consumption of sugary drinks. And much the same was true in Philadelphia, where there was no significant substitution to untaxed beverages, but cross-shopping at stores outside Philadelphia completely offset the reduction in sales within the taxed area. So if people get the opportunity to do it, and that's a lot easier when the tax is only in one town or city rather than an entire country or an entire continent, if people get the opportunity to avoid the tax by shopping out of town, they will, in many instances, do that. Mexico is a very high-profile sugar tax, which was introduced in, let me think, 2014. And it was quite highly cited by campaigners like Jamie Oliver before the UK introduced its own sugar tax, which was announced in 2016 and implemented in 2018. And it was claimed that the sugary drinks tax in Mexico, which amounted to more or less a 10% increase in price on average, had led to initially a 6% drop in consumption, and then by the end of the year, a 12% drop in consumption. In this instance, we see, looking at the pass-through rate, that the average sugary drink went up by at least as much as the tax, so it was fully passed on to consumers, and often by a bit more. And we see, again, a counterfactual from these academics. Looking at the sales, you can see there's a downward trend beforehand, and they think that the downward trend sped up after the sugar tax, and it sped up because of the sugar tax, which, again, is fair enough. This actually shows you the exact figures. So you can see that up until 2011, per capita consumption of sugary sweetened beverages, which, by the way, was and still is the highest in the world in Mexico, had been rising. And actually, I think I was wrong before when I said 2014. It was 2013 when the sugar tax came into effect. It was declining ever so slightly before the tax came in, and it went down a bit more. But we're talking quite small quantities, and still significantly higher than it had been only a few years earlier. Nevertheless, there seems to be evidence there of a drop in consumption, as one might expect. However, there was no reduction in obesity, and in fact, I think the average reduction in calories was something like 4 or 5 calories a day, which is really quite negligible. And there was an interesting unintended consequence, according to this study, which is one of the reasons Mexico drinks so much, fizzy drinks, so many fizzy drinks, is that the water supply is not always so good. The tap water is not particularly great. The government did say that they would use some of the revenue from the tax to improving the standard of tap water, but they didn't really do that. And what this study found was that when the tax was introduced, there was a 6.6% increase in gastrointestinal disease rates in areas lacking safe drinking water. So people were cutting down on their Coca-Cola and Fanta, but they were drinking a bit more tap water, and some of them were getting ill in that way. So again, it goes to show there's all sorts of consequences intended and unintended with these kind of taxes. I'll briefly mention this one from Chile, just because I think it shows how dodgy some of the retrospective research into these taxes are. So what Chile had, it already had a tax on sugary drinks that amounted to about 60p per half litre. That was increased by a quite negligible amount, increased by 2p. And you wouldn't expect that to have much effect on consumption whatsoever. And indeed, if you look at these lines, here's your high tax beverages, you can't really see any change. That's when the tax came in. Well, that's a grace period, I guess. That's when the tax really came in. You can't see any step change there. And the authors accept that. They say in the study, it is hard to detect a clear overall time trend based on pure visual inspection alone, but they nevertheless conclude that there was a 21.7% reduction in high-tax soft drinks purchased. I mean, where is it? So they're using a very odd counterfactual, I think, to get to that. And this is how it was reported, of course, as being another tremendous sugar tax success. Finally, the UK. So the UK tax is a little bit different to some of the other ones. Firstly, as I say, George Osborne, when he announced it in 2016, he made out that this was not a tax on consumers. It wasn't even a tax on sugary drinks. It was a tax on the soft drink industry. It was even called the soft drink industry levy. And Osborne's line was that nobody needs to pay this. The industry doesn't need to pay it, because all they have to do is take out the sugar and replace it with aspartame or one of the other artificial sweeteners. So it's an optional tax, as it were. Now, of course, this is a bit disingenuous, because there are people who actually want to drink sugary drinks, so don't like the artificially sweetened drinks. And if that's what they want to buy, then they have no way of avoiding the tax, assuming it is passed on by the manufacturers, which it was. But the argument was, this is a tax designed to spur reformulation. And people won't notice if you get rid of the sugar from the drinks, and they won't consume as many calories. They'll lose weight without even knowing it. It's health by stealth. Everyone's a winner. And it is true that you did see, I think, accelerated reformulation of some drink brands as a result of the tax. So I don't know if any of you drink Iron Brew or Lucasade or Ribena, or indeed I can see a can of San Pellegrino down there that I believe was reformulated with less sugar. All those other drinks I mentioned were also reformulated, mostly with zero sugar, in fact. All of them already had a zero sugar option, but they essentially withdrew their main kind of flagship brand and replaced it with a low or zero sugar option. And so what you see is that before the sugar tax came in, these are the drinks in green that have less than 5 grams of sugar per 100 millilitres. 66% of those drinks were already, 66% of all drink sales, soft drink sales, were already low or zero sugar. And within 3 years of the tax coming in, that had risen to 88%. And although the direction of travel was already, going there, consumer demand was already for lower sugar drinks, and water in particular, in fact, there seems to be little doubt that some of the companies did respond, not Coca-Cola, but some of the companies did respond by reformulating their drinks. Now, as I say, this is part of a long-term trend. So the not low-calorie drinks are your sugar-sweetened beverages, and they've been in decline quite sharply since about 2003. They've gone down by about 40%. Total soft drinks only gone down a little bit, but the sugary ones have been going down by about 40% in the space of about 10 years. The low-calorie ones have been jumping up, and that has continued since. As I say, the sugar tax was announced in 2016. So consumer demand was already driving those changes. Now, this is a study that only came out last week, and the claim is that, well, this is from The Guardian, children's sugar consumption halved since tax announcement, study finds. Experts say success with soft drinks shows expansion of tax to cover other foods and drinks is a no-brainer. So, I can see a few people shaking their heads, rightly so. Yeah, it's completely unbelievable, and it's not actually what the study said. This, funnily enough, is actually a second version of the headline. This is a corrected version of the headline. The original one said that sugar consumption by children halved after the tax was implemented. The claim, indeed, in the study is that it was the announcement of the tax that made the difference, but they're not claiming that sugar consumption halved at all. And in fact, what they're looking at here is sugar consumption from soft drinks, which is a different kettle of fish. And the halving actually started in 2008. But if you look at the period between 2008 and 2019, yes, sugar consumption from soft drinks by children did halve. But very little of that happened after the tax was implemented, and not very much of it happened after the tax was announced. What you can see here, and this is obviously the graph from the study, is there seems to be this step change. I don't know if you can see these dots, you probably can't, but there's a kind of scatter plot going on behind there, and they've drawn quite a strangely straight line going down to there, which then drops off. And this is supposed to represent people drinking fewer sugary drinks because George Osborne has announced, or is about to announce, a sugar tax. Actually, I think looking at the dots, that if there was a step change, it happened a year or so earlier, which is probably because everyone was banging on about sugar in 2015. You won't remember, I suppose, but there was action on sugar going on about it. Jamie Oliver started his campaign for the sugar tax. There were select committee hearings in Parliament. There was a huge brouhaha about sugar being the new tobacco and so on. So I find it very implausible that George Osborne merely announcing that there's going to be a tax on sugar in more than 2 years' time really would have an immediate effect on sugar consumption. The claim by the study's authors is that, in fact, it did, because it was that announcement that made the companies reformulate their drinks. But that reformulation, such as it was, mostly happened, I don't know if you can see this here, but this shows you the number of, or the proportion of drinks that had a significant degree or level of sugar in them. And there's a little bit of reformulation going on here, but it's not really until the end of 2017 and early 2018. Right before the tax, actually, is when you see the high sugar varieties of things like Ribena suddenly disappear. So the idea that sugar consumption fell at this point in 2016 is quite implausible. There have also been claims, although quite half-hearted claims, saying that the sugar tax has led to a reduction in obesity, which of course was the final outcome that the architects of this tax were after. Again, they've looked at counterfactuals. The reality is that obesity rates amongst both groups that we tend to look at when we're looking at childhood obesity. So that's kids at reception age, aged 4 to 5, and kids when they leave primary school, aged 10, 11. The rates of obesity have increased. They increased the year after the tax, they increased the year after that, and they increased massively the year after that, because that was 2020, lockdowns. There was this huge increase in childhood obesity, which has only been partially reversed since. So here we see the counterfactual is in red, and you can't really see the counterfactual on most of these graphs because it's completely buried by the blue, which is what actually happened. In other words, what actually happened was very much in line with the expectations. With the exception of girls aged 10 or 11, year 6 girls, where the counterfactual is for this rise to occur, and there was only, according to this data, only a small rise. But that is quite hard to square with everything else we know, really. I mean, why would it just be one subset of girls that were affected by the sugar tax? And again, we see most of that divergence from the counterfactual happening before the tax has even been implemented. And we know that the reformulation didn't really happen long before the tax was implemented. So insofar as this is evidence of the sugar tax reducing obesity, and note that obesity did not actually reduce, it just went up slightly slower than these people retrospectively expected it to, if you can get your head around such an idea. It seems to be perhaps a coincidence, because you don't see it amongst any group of boys, and you don't see it amongst younger girls. In the study itself, the researchers speculate that boys are more susceptible to advertising, and that's why they didn't have any effect. But I don't really understand how that would have an impact. The economic impact of these taxes, just to bring us to an end here, is that, well, people who like sugary drinks are going to be quite off-put if you don't allow them a sugary version of the brand that they've been drinking all their lives. So Lucozade, which took all the sugar out, they saw a big decline in its sales, and in the energy drink sector, Red Bull overtook it. Red Bull didn't reformulate, and Lucozade, in fact, had no energy in it whatsoever because there was no sugar in it. And AG Bar, who make Iron Brew, which is very popular in Scotland and the north of England, not quite so popular down here, I've noticed, but a very nice drink, or it used to be. They announced a profit warning about a year after the tax was introduced. They, again, had gone completely zero sugar, and a lot of people were not very happy about this. That's the share price plummeting when this profit warning was announced, and it hasn't recovered since. And then in 2019, the boss of AG Bar came out with what some people might consider a shaggy dog story, but I suppose it could be true. He said that he was looking around the archives of the AG Bar building, and he found in some dusty drawer somewhere the original recipe of Iron Brew from 1901. And he got it out, and he thought, this is a veritable piece of Scottish history and must share this with the world. So he decided to make this drink from the 1901 recipe, and he put it out as a limited edition. And would you believe it had more sugar in it than the one they just discontinued, and people quite liked it. And so now that sells at a premium. It's no longer a special edition, it is just available all the time, but it's quite expensive. And yeah, so we had the new old recipe. And in fact, it says on it, if you see it in the shops, it says old and unimproved. So they're really making a virtue of the fact that it hasn't been improved, because in fact a lot of their consumers didn't want it to be improved. And so how do you draw these threads together at the end of the talk? I think the point is that it's very difficult to predict what's going to happen when you introduce a tax like this. I focused on sugary drinks taxes, but you can apply this. There may well be a vape tax coming up quite soon. That's going to have unpredictable consequences because, again, substitution effects, right? If you have you taxing e-cigarettes, what's the obvious substitute to an e-cigarette? It's a cigarette. Are we wanting to implicitly encourage smoking, or maybe people will just stop using any form of nicotine, or they'll go to nicotine pouches? We don't know, because we've got some evidence, because e-cigarette taxes have been tried before, and they do tend to, in fact, increase the sale of conventional cigarettes. But my point is, it's unpredictable. And what happens in one country is not necessarily what happens in another country. You don't even know how the industry is going to respond to the taxes, whether they're going to absorb the tax, whether they're going to reformulate the drinks, whether they're just going to advertise more, who knows. But the demand for food and drink is very inelastic. There's no country I know of, and I'm pretty sure I know of them all, where sugar taxes have actually reduced obesity, as in obesity has actually gone down as opposed to going down compared to a counterfactual. And people are creative. They will, there's all sorts of substitution options available to them. There's often cross-border shopping options available to people. And sin taxes in general are almost invariably regressive. So pretty much all indirect taxes, apart from, let's say, if you had a tax on Ferraris specifically, that would probably be progressive. But we don't really have luxury taxes in this country. So indirect taxes are always regressive in that they take a greater share of income from the poor than from the rich. And in the cases of things like sugary drinks and tobacco, these products tend to be disproportionately consumed by people at the lower end of the socioeconomic ladder anyway, so in a sense they are doubly regressive. So look, you can point at anything and tax it, and if you're trying to tax something that's not everybody uses, or maybe is only used by a minority, then you're often going to get quite a sympathetic hearing from the majority, because it's not going to affect them and they get their public services subsidized. But there are all sorts of problems with them, not just on philosophical grounds, but on practical grounds. People don't always move in the direction that governments and bureaucrats expect them to or hope they will. So that's the talk, and we got time for questions, and someone's got a microphone somewhere, have they, maybe?
So the difference between this drink and this drink is that the diet version doesn't have sugar, but it's got the replacement, which is like a sweetener. Mm-hmm. But there have been scientific studies that show that sweeteners also cause cancer. So how would you argue that that is another argument against sugar taxes?
I would argue it's an argument in favour of not using state coercion to push people one way or the other. I personally don't believe that artificial sweeteners do cause cancer. I know there have been studies on, which one is it? Aspartame perhaps, or maybe saccharin. There were claims in the 70s that if you pump a rat full of this stuff, then they develop cancer. But people aren't rats, and there doesn't seem to be a lot in the way of human evidence of that. But I don't know, I'm not an expert on it, and of course hardly anybody is, and why should you have to be? I think the important thing is you should have the choice, and if you don't like artificial sweeteners, whether because you have health concerns or whether you just don't like the taste of them, which is a perfectly legitimate reason not to want to drink them and to prefer sugary drinks, then I think that should be a free choice and not a choice that is either taken away from you completely, in the case of Iron Brew, albeit that is a sort of a private sector decision, or with a bit of nudging from government, or by the government in general. So I say, let a thousand flowers bloom, and I don't have a position on these questions of science and risk particularly. It doesn't worry me drinking diet drinks, but I personally don't like the taste of them, and so I don't see why I should really be penalised as somebody who's not obese. Or even if I was obese, I don't see why I should be penalised for making that choice. But there is a possibility. Let's say we find out in 20 years' time that one of these artificial sweeteners does cause cancer or does have some terrible effect. It's been a great example of government failure, and the government should have maybe not shouldn't have known about it. Perhaps it would be a genuine revelation if that happens, but they would be kicking themselves for forcing people in that direction. And there are plenty of precedents for that happening. Diesel cars, for example, 25 years ago, the government was very keen on pushing people away from petrol cars and towards diesel cars. And the diesel tax was made lower than petrol duty. And then, 10 years later, they said, actually, we found out that diesel is much worse for air pollution than we realised, and much worse than petrol. And so that's kind of a mistake. I think there's quite a few countries around the world who are currently highly regulating or banning e-cigarettes, which they'll come back and see that as a mistake. So I think let individuals make their own mind up, by all means try and educate them, but I think that is one of the risks of government intervening and trying to push consumers towards certain products when we don't actually know what the real effects of that are going to be. Yes, just wait for the microphone, please.
What do you think the alternative sources of income for the government would be if they don't implement like a sin tax? Because obviously taxes generates revenue for the government.
At one time in the 19th century, the British state was making about a third of its total income from alcohol and tobacco taxes, and a pretty similar level, I think, in America. One of the reasons that they finally brought in prohibition in America is because the government was less worried about losing tax because they just introduced an income tax in 1916. So traditionally, these kind of vice products, these unhealthy products, have been huge revenue raisers for the government. Now, today, in countries like Britain, the government takes so much of GDP as tax, getting on for 40%, that the amount they get from tobacco and alcohol revenues is relatively small. But it's still well over £20 billion, just those two products. The sugar tax brings in £300 million. So it's not chicken feed. The government can't afford to do without it. To answer your question of if they got rid of those taxes, what would they tax? Well, they could try cutting the size of the state, but if they're not prepared to do that, there are plenty of taxes available. I don't have a particular recommendation for what they should tax, but we tax indirectly lots of things through VAT. We obviously tax income, we tax corporations, we tax capital gains. There are all sorts of areas that if you had to raise taxes, you could pick one of these. Then the question just becomes, well, which of these is easiest to implement? Which of these is least distortionary? This are the usual questions you would have in tax policy. But, all taxes have their problems. I've explained some of the problems with sin taxes here. But I guess you could say one of the advantages would be they're relatively easy to collect, which is usually a good thing. Like VAT is quite easy to collect, as long as you're not pushing people towards the black market. They're easy to collect, and they're a very reliable source of income because the demand is really inelastic. And I think in practice, that's why governments like taxing these things so much, because they know they can keep putting that tax up and up and up, and people will still keep consuming it. A pack of cigarettes now, I think it's like £16. When I started smoking, it was £2. And there's fewer smokers today, but there's still 7 million going out and maybe not all buying legit cigarettes, to be fair. That goes back to the black market question. But there's demand is very inelastic for a lot of these things, for food, for alcohol, and for tobacco. Yes, could you get the microphone? Yeah.
Would nudges be better than attacks?
Well, nudges are better than attacks from a libertarian point of view, because nudges are supposed to be libertarian paternalism. So yeah, I mean, the basic answer is yes. The trouble is that you're not going to get massive behavioural change from nudges. And do you all know what we're talking about when I say nudges? So nudges are, this is from a book from 2008, Richard Thaler and Cass Sunstein wrote a book called Nudge, which was supposed to be the kind of third way libertarian paternalism, in which we know that people don't always make the right choices, even by their own, even on their own terms. So what can we do to kind of correct these systematic cognitive biases that people have? So for example, lots of people say they want to save more for their retirement, but they fail to do something as simple as opting into their workplace pension. People say they want to allow their organs to be used after they die, but they don't get around to putting their name on the organ register. A lot of this just comes down to kind of laziness, really, but also comes down to the defaults that are set up in life. Now, one of the big nudges that the UK government took on from that book was opting people into workplace pensions. And we now have that as the default. So when you start a job, you're automatically opted in unless you make the conscious decision to opt out. It used to be the other way around, and unsurprisingly, people tend to go with the default. Now, I'm not 100% sure that's necessarily the best default for everybody, in actual fact. I would say that people in their 20s would probably be better off saving up for a mortgage deposit than they would saving up for their retirement. I don't know. And it obviously depends on the individual. But we can't be certain that everybody would benefit from a nudge like that. On the public health stuff, however, there's really so few examples of nudges that make much of a difference. You can, they mention in the book something about how if you say you want to give up smoking, you keep putting money in, and if you give up, then you get twice that money back or something like that. And if you start smoking again, you lose all that money. So these are these sort of commitment devices that people can opt into. But there's not much else. There's the stuff about, positioning the fruit and veg at the front of the cafeteria and putting the chips at the back, and people are more likely to get the fruit and veg. It's fine. It might have an effect on the margins, but you're certainly never going to get the kind of behavioural change that people in public health want, which they want, very clean living across the board. And for that reason, people in public health no longer really talk about nudge. unless they're getting the term wrong and referring to a ban as being a nudge. So it doesn't have, in my opinion, a great deal of scope for the kind of behavioural change that governments are after. Yes, can we get a mic? Hmm? Well, you've got it? Who's got it? Oh, they're taking it out of the room. Okay, can you speak up nice and loud, please?
So do you think that if people were to get an illness such as liver failure, high cholesterol, heart failure, all that sort of stuff, and based throughout their lifetime they had a huge consumption of sugar, saturated fats, like, you know, they went to Krispy Kreme every day. Do you think they should have the right to use the NHS?
Yes, I do. The question for anybody watching at home is, do people who live a very unhealthy life have the right to use the NHS, essentially? Yes, because they pay into it, same as everybody else does. And there's very little evidence that people who live a, quote, unhealthy life use more healthcare than people who live a very healthy life. And in fact, in many respects, people who live a very healthy life and go on to live to the age of 105 cost the government a lot more than somebody who has a heart attack from eating too many cream buns at the age of 67. Not just in terms of healthcare costs, because they've avoided all those cataract operations and hip operations and things that people get when they become very old, but because they are not taking out very much in the way of pension payments and other old age benefits. So there is this myth that people who are smoking, drinking too much, eating too much are costing the state a fortune and the NHS is going to go bust as a result. It's pretty much the opposite of that, in actual fact. The real pressures on the NHS and other health systems worldwide are from an aging population. And we have an aging population partially because people are actually living healthier lives in many respects, in particular in not smoking as much as they used to. So I think it would be extremely problematic to try and ration healthcare on the basis of lifestyle. It's also very difficult in any given case actually to prove cause and effect. So you mentioned heart failure. Well, heart failure is the most common cause of death. You know, if the doctors can't diagnose you or anything else when you're 108, they go, well, your heart stopped, so it's heart failure. So it's hard to prove cause and effect. It would go against the spirit of the health service anyway. What you could, of course, have is a health insurance system. If you had a health insurance system, then people who had certain lifestyle behaviours would end up paying more. So smokers would pay more, obese people would probably pay more. And so it would be a more efficient system in that sense. But when you're talking about public services in the round, you can't just look at healthcare, you've also got to look at welfare and the amount we spend on pensions and so on. So someone could equally come back with the argument of, you know, I lead a really unhealthy life, eat nothing but chips and smoke 60 a day. I'm going to be dead by the time I'm 60. Why should I have to pay for all these people's pensions? You know? So I just think it's the economics of it don't really stand up. And I think, given that we are forced into this system against our will, essentially, even if we go private, we still have to pay for the NHS. We're all forced into this collective system. It seems to be very unfair to then say we're forcing you to pay for one another's healthcare, and we're also going to tell you how to live because we want to try and keep this system as efficient as possible. Seems to be unfair, but also, as I say, the economics of it don't really stand up because it's the ageing society that is putting the real strain on public services. Yes. Oh, we've got the microphone back. How did it run off?
Surely mandatory private healthcare insurance externalizes the cost of bad healthcare decisions to insurers. Would you recommend a Singaporean-style mandatory health saving instead, or how would you set that up? Yeah,
well, I would do, but not particularly for that reason. Just because I think it would be a better system in general to have an insurance-based system, because the system we've got, the NHS, this vast leviathan, which nobody really fully understands or can control, it's not working. You know, it's a huge state monopoly, and it would be much better to have competition in there and have hospitals and doctors and what have you competing, and having bad hospitals being closed down rather than being bailed out and all the rest of it. So any kind of private-public partnership insurance system in which, if you can afford to pay for your own insurance, you do so. If you can't afford to pay for it, the state pays for it. But then you make your own decisions about where you get your healthcare from, rather than having the government providing it all, owning all the hospitals, which it is never needed to do in order to provide universal healthcare. You know, most countries, virtually every Western country bar America, has healthcare that is universally accessible to 99 to 100% of the population, and the 0.1% that sometimes are not covered are just migrant workers. Every major country has that, but they don't have an NHS system because it would never occur to them to do it that way. Because actually, why, when you think about it, why do we need the government running the healthcare in order to ensure that people can get healthcare? We don't need the state running farms to make sure that everybody can eat food. We give people who can't afford it money to buy food, and it should be the same with healthcare. Oh, that's convenient, right next to you.
What alternative policies would you suggest for decreasing the consumption of these goods, or do you just think that any interventions in these markets is just a pointless feat anyway?
Well, it's neither really. I just don't think it's any of the government's business. I don't think the government has the knowledge to know, what my optimal amount of consumption of sugar is versus your optimal amount versus their optimal amount. People are different. People have different tastes and preferences. People have different tolerance of risk. But so long as people are aware of the risks, I think we have to assume that adults, at least, are capable of making decisions. Nobody, in actual fact, wants to live a completely risk-free life. Everybody takes a risk to some extent. And so, so long as people are reasonably well informed and reasonably rational, I don't see why the government should be getting involved in trying to change our consumption habits, trying to make us eat less of this or more of that. Other than if there is a kind of information asymmetry, like I say, if people are ignorant, then maybe the government can do something to inform us. But I'm not sure actually that is the case with any of the products I'm talking about here. I think the dangers of smoking are extremely well known. I think the dangers of drinking are well known. And I don't think that there's a lot of people walking around thinking that, celery should be avoided because it's really bad for you and cream cakes are health foods. So I don't see a problem that requires remedial action. Don't see a market failure, basically. Got 5 minutes left. If anyone's got some questions or comments, yes.
How often do you think the rise in these sin taxes leads to a fall in tax revenue and also leads to not significant enough sort of fall in consumption due to people like going to black markets? How often do you think that happens?
It depends very much on the product. What you're talking about there is the Laffer curve, right? So the Laffer curve is when you tax something so much, you start getting less revenue than you did before because people are not paying the tax. Now that might be because they're giving up buying the product, in the case of the stuff I'm talking about, which of course is what the government wants. The Laffer curve has been reached on tobacco taxation in this country. A few years ago, every time tobacco tax goes up, the revenue comes down now. But of course that's partly because there are fewer people smoking. It's also because fewer people are buying cigarettes from actual shops and are buying it on the black market. So that's an issue. So we have hit the Laffer curve. If the aim of policy is to optimize revenue, which I think often it actually is with things like tobacco, then we've gone beyond that point. But it very much depends on what the tax is and how high the tax rate is. I don't think there's any danger of it happening with an 8p sugar tax. But there's more of a market in kind of illicit alcohol than a lot of people realize, and there's a very big market in illicit tobacco. So there are instances where revenue will come down, and that's what the government wants, and the government will be quite happy about that, at least publicly. On the slide, it's probably looking for something else to tax to try and make up for it. So electric cars, for example, are probably going to be taxed in the next few years if enough people switch to them, because the government's going to lose out on £30 billion fuel duty. Vapes are probably going to be taxed quite soon because of the Laffer curve on tobacco taxation. So the government's commitment to public health and reducing air pollution only goes so far. In actual fact, they will start taxing these better alternatives because it needs the revenue at some stage. But look, the Laffer curve does exist, and it's because people are not paying the tax. Whether that's because they've stopped buying the product or because they're buying it elsewhere or getting around the tax in some other way really depends on the situation in whatever country we're talking about, whatever product we're talking about. Right behind you, please.
What policy changes would you implement in order to make people less regular with sin taxes?
Well, I wouldn't, because it's not it's not really what I'm interested in doing. I'm interested in evaluating policies that are put forward by other people, particularly when they come into force. But I don't think it's my business to make people live healthier lives because I don't know what their desires are. You know, is there actually latent demand for people leading healthy lives? Would people actually welcome the government forcing them to go down the gym 3 times a week? I don't know. Maybe some people would. There's always a certain minority of people who do want the government to tell them what to do want some kind of commitment device. But most people I don't think do. So yeah, obviously health is a good thing. Being healthy is a good thing. But lots of other things are good things and enjoyable things and things that make life worth living. And there's a trade-off there. You know, so yeah, that's what risk is. It's a trade-off, really. So you know, people do want to be healthy, they do want to be slim. At the same time, they do like eating pizza and ice cream, and you can't have both necessarily, unless you do lots of exercise. But you don't want the government to force you to do that either. So I'm not interested in state coercion to try and make people healthier. I'm interested in public well-being, which is a very different thing to public health and a more expansive and holistic thing actually than public health. And I think public well-being can best be furthered by allowing, you know, reasonably well-informed and rational people to have free choice and to pursue happiness in their own way. And that's probably a very good place to end it. Thank you very much for your attention, and hope you enjoy it.